Our next presentation, the title is Performance of Milk Leukocyte Differentiation Test in Selective Dry Cow Therapy Approach by Dr. José, Denis-Robichaud from Canada. I hope I got that right.
It was very good. Thank you very much for the introduction and for having me here today. I will, as was presented, talk about the performance of milk leukocyte differential as a potential approach for selective dry cow therapy. And we already heard about selective dry cow therapy, and I have to say, Lauren, I'm a bit jealous of your numbers. But we know that selective dry cow therapy would treat the quarters or the cows that are infected only, and it has, as Pam presented, an economical impact and also a big impact on antimicrobial resistance. It does, however, requires to identify which quarters or which cows are infected. And the diagnosis of intramammary infection is, as presented previously, bacteriological culture. And even though it is an extensive and expensive test to do, there is actual research on farm cultures. However, not every farm has the ability, or not every clinic has the ability to do that testing. And some research was presented on somatic cell counts and CMT tests as an approach for selective dry cow therapy. The company I was hired by for this research is Advanced Animal Diagnosis. It's an American company, and they are developing milk leukocyte differential, which has been showed in few studies that has the potential to maybe improve the diagnosis compared to somatic cell count for intramammary infections. And they developed a MLD test called the Q-Scout, and they are interested in learning more about their product and justify probably its use in a selective dry cow therapy context. So we did 2 experiments that I will try to summarize today. The objectives were, one, to determine the ability of the test to detect intramammary infection in late lactation dairy cattle. And then in the second experiment, the objective was to compare udder health and milk production between cows treated with complete dry cow therapy and selective dry cow therapy using MLD test. I will go through all the methods for both experiments and then the results for both experiments. So bear with me. I tried to make it obvious by the title on top. So first experiment, the study design was a cross-sectional study in one dairy herd in North Carolina. All cows over 280 days in milk were included at the visit, and it required no visible change in milk. Sampling was done for every quarter for MLD, but also for bacteriological culture on the cows. So for MLD test, it is the differential is measuring lymphocyte, macrophage, neutrophils, and non-cellular debris, and they have an algorithm. I will not put you through this, but you can use 12 different thresholds in the research mode to classify your quarters as positive or negative. And then for the bacteriological culture, we went with the NMC suggestions for classifying udders or quarters, as positive or negative. For the statistical analysis, very standard, the gold standard was bacteriological culture, and I looked at sensitivity, specificity, and predictive values. For the second experiment, we did a randomized control trial in also one herd in Idaho. The sampling, so we started one day before dry-off. We took samples for all the quarters, and they were classified with the MLD test as positive or negative. They used the index number 6 from the SMART result algorithm, which is the one recommended by the manufacturer. And then cows were randomly assigned by parity, but also by the number of positive quarters at that testing. Then cows were dried off. In the complete dry cow therapy, all quarters were treated with intramammary antibiotics and external teat sealant. And for the selective dry cow therapy, only the positive quarters, not the positive cows, were treated. And then during the subsequent lactation, we followed the clinical mastitis events, milk production, and somatic cell counts. For statistical analyses, for the geeks in the room, I did quasi-Poisson regression, and then for the clinical mastitis events and milk production and somatic cell counts were analyzed with mixed effect, linear regression with repeated measure structure. And they were all adjusted for confounders, and obviously parity was an important one as presented in many previous research. For results, I will start with the summary because I would like you guys to remember that the most from this talk. So when we compared MLD test to bacteriological culture, the test was at a fair to good accuracy to identify intramammary infection, depending obviously on the threshold used, because as I told you, we used 12 different thresholds, and I'll show you a bit more details. So that study was on 94 cows, a total of 373 quarters. The median somatic cell count in these quarters was 67,500 cells per ml, and the true intramammary prevalence as by the bacteriological culture results was 12%, and at the cow level was 32%. So I'll walk you through this one. We had 12 thresholds, but for time purposes, I will present you only 3. And they are identified 1 to 12 by the manufacturer. And if you look at, let's say, the threshold 1, which has the highest sensitivity, it identified 111 positive quarter, which gave apparent prevalence of 31%, which, if I show you the previous one, the true prevalence at the quarter level would have been 12%. So it would overestimate the prevalence. If you change the threshold, you can gain some specificity. So you go from 76% to 92%. But like in every test, when you move the threshold, you will change both sensitivity and specificity. So if you change that threshold, then you get a 44% sensitivity. And then I also put the number 6, which I told you was used in the second experiment as the manufacturer recommendation, and it has a middle ground sensitivity and specificity. For the second experiment, so let me back up a second. So when you look at how MLD would compare to bacteriological culture, it gives you an important information. However, it does not tell you how it would perform in a selective dry cow therapy approach. So by using that randomized control trial, we really wanted to have a good impression of what was happening in that situation. So the results we obtained in this experiment was that there was no difference in health and production parameters between cows treated with complete dry cow therapy and selective dry cow therapy using MLD. So this research was done on 322 cows, almost equal groups, and then at dry off, the median somatic cell counts were 31,000 cells per ml, and the production was 27 kilograms. And here you have the number of positive quarters. So most of the cows had all negative quarters, so for 39%, and then 16% of the cows had 1 quarter positive, 12% had 2 quarters and 3 quarters positive, and then 21% had all their quarters positive to MLD test. And here is the big table. Don't panic. The blue is the important part. So the model was, as I said earlier, adjusted by parity, but also by confounders. But if you look at complete dry cow therapy to selective dry cow therapy, the incidence rate ratio was not significant. And as I said, I'm very jealous on Lauren's numbers because we had only 160 per group. which would not have identified really, really small difference. But if you put this in number, because in this incidence rate ratio maybe is not super obvious, maybe incidence rate is not either, but that means that in the complete dry cow therapy, there were about 7 cases of mastitis by 10,000 cow days at risk. It is relatively low. It is a farm with a really low problem in mastitis, and then the difference would be an incidence rate of 7.8 in the selective dry cow therapy treatment. When we looked at milk production and somatic cell count, you have in pink, I guess, the complete dry cow therapy cows, and in blue, the selective dry cow therapy. So I think it's pretty clear. This is the test days, and this is the milk production. And then for somatic cell count, it's on the log scale, but test days and then log scale somatic cell count, there was no difference between groups. There was, however, a difference between test days, so higher here, lower here, but in both groups. So to briefly summarize what I just presented, even though the MLD test did not identify all the cows that were positive to bacteriology in late lactation, it was possible to obtain good results when used as a tool for selective dry cow therapy. I would like, however, to point out that in both experiments, the somatic cell count in these herds were extremely low. So, and it was, again, both time one herd. So it is hard to generalize that data to all your herds. However, it is a first step in the understanding of how we can use MLD tests on farms for selective dry cow therapy. And with that, I will take any question.